Hello students, welcome to the Pediatrics Pointer, your ultimate revision program in the pediatrics. The first topic which I have taken today is the cyanotic congenital heart disease with decreased pulmonary blood flow. And in this we'll be talking of the Tetralogy of Fallot, we'll be talking of the tricuspid atresia and Ebstein's anomaly. First we consider is the Tetralogy of Fallot. In the Tetralogy of Fallot, there is presence of subvalvular or infundibular pulmonic stenosis. So pulmonic stenosis mostly is subvalvular. There is right ventricular hypertrophy, there is VSD ventricular septal defect, and there is overriding of aorta. The points to be remembered, there is no murmur of VSD. The pressure in right ventricle, left ventricle and aorta is equal. So there is no murmur of VSD. The only murmur you get is the pulmonic ejection systolic murmur. There is the pulmonic ejection systolic murmur, and that is because of the pulmonic stenosis. This murmur is present. So if you basically see the picture, this picture of top is something like this. There is this subvalvular pulmonic stenosis. The overriding means the aorta has been displaced slightly towards the right side and the lower end has been pulled upwards. So it is getting the blood both from the right ventricle as well as from the left ventricle. Right? Then there is a thing which you get is hypoxic spell, which is also called blue tet or hypercyanotic spell. The concept says during exercise, maybe a child is crying, there is peripheral vasodilation, the systemic vascular resistance decreases. So if the systemic vascular resistance decreases, it becomes easy for right ventricle to pump the blood to aorta. More blood go to aorta, less blood to pulmonary artery. Aorta gets more amount of deoxygenated blood, less amount of oxygenated blood, and there is hypoxic or anoxic spell. This can be called as blue spell, hypercyanotic spell, anything it can be called as. And due to this hypoxic spell, there is presence of acidosis, there is tachycardia, and there is tachypnea. For the treatment of acidosis, you are giving is sodium bicarbonate. For tachycardia, you are giving is beta blockers. You can give propanol, esmolol. And for tachypnea, you need to depress the respiratory center. You are giving is morphine, or you can very well give is ketamine also. Also, you also need to increase the systemic vascular resistance, for which you can go for the knee chest position, and you can also give the vasopressor, that is phenylephrine. So this is in short regarding the hypoxic spell. And in the hypoxic spell, there is decreased pulmonary blood flow. This leads to the decreased intensity of the pulmonic ejection systolic murmur. Decreased intensity of the pulmonic ejection systolic murmur. Right? Then which all complications can we see? There is cerebral thrombosis. It is a cyanotic congenital heart disease. So this causes hypoxia. Hypoxia leads to the increased amount of erythropoietin, and erythropoietin causes polycythemia. And due to polycythemia, there is increased risk of thrombosis. Brain abscess can also be seen because thrombosis will ultimately lead to the ischemic necrosis. There is bacterial endocarditis because the pulmonary valve is damaged here. One important thing again, congestive heart failure is not seen in TOF. In the isolated TOF, you don't get is the congestive heart failure. If you particularly see the chest x-ray, you get here is the upturned apex, and this upturned apex gives the appearance of the boot-shaped heart. Boot-shaped heart. What is to be done at birth? At birth, you want to increase the prostaglandin. You want to basically increase pulmonary blood flow. For this, you are giving is prostaglandin E1 infusion, which will keep the ductus open and the pulmonary blood flow will increase. You can go for palliative surgery, that is Bullock Toshik shunt. You attach subclavian artery with the pulmonary artery, BSP, Bahujan Samaj Party. Right? This is just to increase the pulmonary blood flow, and this is a palliative surgeries. Otherwise, nowadays you go for the definitive surgery, don't go even for the palliation surgery. This was the first, which was Tetralogy of Fallot. Then is tricuspid atresia. In the tricuspid atresia, there is absence of tricuspid valve. If the tricuspid valve is absent, right atria cannot pump the blood to right ventricle. How the blood is reaching the right ventricle? The blood first goes from the right atria to the left atria. then to the left ventricle, then to the right ventricle. So which murmur is present here? A murmur is pansystolic murmur. The point you need to understand here, left ventricle maintains both pulmonary and systemic circulation. So there is left ventricular hypertrophy. So if the question says cyanosis plus LVH or cyanosis plus left axis deviation on ECG, your answer has to be tricuspid atresia, right? Normally in the cyanosis you get RVH. This is cyanosis plus LVH. What you are getting here is. Here too also hypoxic spell can be seen. The hypoxic spell, the same which we discuss in TOF, can also be seen in the tricuspid atresia. Then is Ebstein's anomaly. Ebstein's anomaly is associated with the mother taking lithium during pregnancy. So what basically happens here is downward displacement of the septal and posterior cusp of tricuspid valve. Due to this, some portion of right ventricle merges with the right atria, which is called atrialization of right ventricle. And as the valve has become irregular, there is also tricuspid regurgitation seen. Now basically what happens, there is increase in the size of the right atria, and this can lead to the compression of the lungs causing pulmonary hypoplasia. And also here there is decrease in the size of right ventricle. Due to the increase in the size of right atria, you can what see is the box shaped heart. You can see is the box shaped heart. At birth, what you like to go for? Prostaglandin even infusion, because right ventricle is pumping very less blood to the pulmonary artery. If you want this child to survive, the ductus arteriosus has to remain patent so that the pulmonary blood flow increases. That's why what you say here, pulmonary circulation is ductal dependent. Pulmonary circulation is ductal dependent, right? I hope this was the first part I have covered. Cyanotic congenital heart disease with decreased pulmonary blood flow. Do subscribe to the channel and please do comments on the video. This is just a motivation for us also. Thanks for watching. Bye.